Now, waiting for an ambulance can be frustrating. It can also be very frightening when there's a real emergency. But new research shows that the region's paramedics are increasingly being called on to help with non-emergencies, elderly people who have had falls and dealing with mental health problems.
As it comes as call-outs increase significantly, it's hoped the findings will help stem the rise, as our health correspondent Jenny Walrond explains.
Every day is a busy day at ambulance control. They have to deal with 470 more incidents per day than they did 5 years ago. And that means that people who are poorly are having to wait longer for help. So researchers at the University of Exeter were asked to find out why.
We recommended that they prioritise falls prevention strategies to try and reduce the number of ambulance call-outs because of falls, and also to get a better understanding about why those with mental health problems are tending to use ambulances more frequently than the rest of the population.
And recent analysis by the ambulance service itself suggests that, on average, once a day, an ambulance is called in appropriately by a care home or care provider to lift a person in the southwest who has fallen but is uninjured. The most common reason is the enforcement of so-called no-lifting policies by care providers. South Western Ambulance is now taking on the research findings and trying to negotiate with health commissioners to ensure frail people get the care they need and people with mental health conditions are supported to use the ambulance services appropriately.
We're trying to access mental health professionals directly in a timely way so that we can get help and support from the services that know these patients best. And we're trying to understand that when somebody needs to go for further help and support in a hospital, that we try and ensure that they are able to access the destination that's most appropriate for them.
The number of 999 calls has increased by 24% in the last 4 years, but of course funding hasn't gone up by anywhere near that amount, so something must be done to ensure that paramedics can reach the people who most need their care. Jenny Walrond, BBC Spotlight, Exeter.